Well, if you're looking more tired than you feel, you may need a little lift. Holcomb Crathen Plastic Surgery has an innovative technique, and they are using to help people look younger than ever. Dr. David Holcomb joins us now to tell us more. Dr. Holcomb, great to have you back.
Thank you. Glad to be here.
So you use lasers with your lifts, right?
Yes. So depending on patient goals, we may use a fiber laser, which is a special laser that melts fat underneath the skin to help us contour the neck and the lower face. And then if they also have maybe some wrinkles or sun damage, we may use a laser externally on the outside part of the skin to help tighten the skin and tone the skin.
Well, once upon a time when you heard facelift, it was, there was a full scar that was going over the top of the head, and it was a major, major surgery. So how is this different?
Well, so we're today not talking really about brow lift, but really this lower face and neck.
And this is what goes most often, right?
Well, the jowls start to happen, in sort of the late 30s, early 40s, and they progressively get a little heavier in many people. And the neck, we start to accumulate some tissue underneath the chin and the neck. So what's really nice, and I switched about 8 years ago from doing traditional cold liposuction to what we call laser lipolysis. So we use a fiber laser, which is about the size of 6 human hairs, the width of 6 human hairs.
Oh my goodness.
Like a vermicelli noodle.
It's amazing.
It goes underneath the skin, and we engage the fat with the laser fiber. The light energy comes out of the end of the fiber, and it basically is absorbed by the fat. It helps the fat cells to break apart. It even liquefies the fat a bit, and it makes it much, much easier to then remove that fat versus traditional liposuction with a much bigger cannula. So I used to use a cannula that was sort of this long and had to push it through. Now we're using something that's much, much smaller, like this, the diameter of perhaps an ink cartridge and a pen, just attached to a syringe. So instead of a machine and a big thing, small cannula and a syringe, and it's technically easier, but I think more effective, and we see less bruising as well.
Well, I was going to ask, what's the recovery like? Are patients asleep during this? Are they awake during this?
So you don't need to have general anesthesia to have this procedure, and I would say 99-point-something% of our patients do not have general anesthesia for this procedure. So light IV sedation or a little bit deeper IV sedation depending on patient preference, but essentially it's an outpatient conscious IV sedation procedure done in the office. You can go home if you're, if you live reasonably close. If you're from out of, far away, then we recommend a hotel for one night.
I was going to ask, okay, what's the downtime like?
Yes, so the initial recovery period is really 7 to 10 days. At that point, really all the little sutures should be out and much of the swelling should be down. And you can start to really engage in most activities, holding off on, say, extreme aerobic activities for a couple of weeks, though.
I'm curious, does the laser resurface the skin as well?
Yes, so not that particular laser.
Okay, this is something else.
But patients do have that done, though, at the same session many times. So we use the fiber laser to contour the lower face and neck, do the lifting part. At the end, then we will use a different kind of laser, whether it's an erbium YAG laser or a fractional CO2 laser, sometimes both, to tighten the skin, remove wrinkles, and improve the skin tone and texture.
And all your friends know is you look really refreshed, and they can't believe how great you look, and they think you're so rested.
Yes, after just a little bit of healing time.
That is wonderful. So to schedule your consultation at Holcomb Crathen Plastic Surgery today, go to sarasota-med.com or tampa-med.com. Doctor, thank you again.
Thank you.
We'll be right back.